The Queen Elizabeth Hospital, saying there's clear evidence that cultural problems persist there and require serious attention. Sir Robert Francis, the barrister who led the Mid-Staffs Hospital inquiry, tonight told Newsnight that patients will not be safe in any organisation unless the staff feel they'll be supported if they speak up about their genuine concerns. David and team have been investigating the trust since autumn. Here's his latest report from Birmingham.
A culture of fear in one of England's biggest hospital trusts.
Newsnight's investigation into UHB uncovered allegations of a toxic culture.
What happens to Birmingham patients is just shocking.
Where staff who raised patient safety concerns feared punishment.
You will get punished quite quickly and quite harshly.
In response to our findings, the NHS began 3 reviews. The first, by Professor Mike Buick, reported today.
This sort of culture of fear, I'm afraid, is still prevalent, and people are still reluctant to come forward. And our review, after your own Newsnight reports, has confirmed many of those fears. We haven't found any evidence that the Trust is in disarray in terms of clinical safety, but this sort of corrosive effect of an environment where people are not free to speak up or feel not free to speak up, this corrosive effect will have effect on patient safety if things aren't reversed quickly.
In the middle of our investigation, the Trust wrote to Newsnight telling us that they would no longer be answering any of our questions. Today, though, we were invited in to speak to the acting chief executive.
The report sets out some very concerning things about the culture of the organisation. What I've been doing in the last 3 months since becoming chief executive is getting out and speaking to as many people in the organisation as I possibly can across a whole range of different professional disciplines to understand what they feel about working in the organisation and the way in which they're treated. And what I'm hearing is a range of feedback that is proving very helpful in understanding where we need to target our efforts in order to improve the culture and improve the kind of sense of belonging and ownership that people feel in the organisation and how they're treated. So we're very committed to sorting that out. I fully accept Professor Buick's report and all of the findings and recommendations that are made. I think that the report reflects that the organisation overall is a safe place for patients to access and receive care and treatment.
In 2017, Dr. Manos Nikolaousis, a consultant haematologist, was commissioned by the Trust to look at cases of 19 patients in the haematology department of Queen Elizabeth's Hospital who died. He found that a lack of ownership among clinicians meant that some patients died without receiving any treatment at all.
So when you raise concerns...
When Dr. Nikolaousis alerted the Trust, he told us back in November that he wasn't clear that any notice at all was taken of his warnings.
There was definitely a lack of safe patient care and a lack of ownership of the patient, a lack of looking after the patient the way they should look after these patients in a very detailed way.
In today's report, Professor Buick has recommended a full review of the cases concerned. The response to the report was, he wrote, inadequate given the nature of the concerns raised and the lack of any apparent formal response or documented action arising from the findings.
It is not clear that relatives were informed about the review.
This has all come too late, certainly, for the family of Frank Bird. He died in the haematology department of Queen Elizabeth's Hospital after a catalogue of serious mistakes, a full 2 years after Dr. Nikolaousis submitted his report. The Trust has previously apologised and paid an undisclosed sum to the family. His family say he would be alive today if the Trust had taken these safety concerns seriously.
If they'd have took that Dr. Manos's report more seriously, my dad's life could have been saved, because all those things that was going wrong that he spotted, they could have been changed, they could have been put right. Something could have been done about them to stop further deaths in the hospital. I feel like I should have shouted and screamed at somebody until they listened.
And you feel like you can't, can you? Because you feel like you're not supposed to do that.
I did more. All the time. And he always expected that of me, because that's the way he brought me up, was to use my mouth and talk. And I didn't, because doctors are higher than you and they know what they're doing.
For sure they killed him, and that's it. I know that. And they're not accountable because they're like God, aren't they? They can do what they like and get away with it.
We have apologised unreservedly to the family of Mr. Bird, and we are deeply sorry for his death and the circumstances surrounding it. What we need to do is make sure that we learn when we don't get things right so that we can reduce or eliminate the chance of them happening going forwards. And there's many, many areas where we do that extremely effectively, but there's areas where we need to do it better. And what I'm committed to doing is making sure that we do it far better, that we support staff to do even greater things for patients, because that's what we're all about.
Tristan Reuser is an eminent eye surgeon. An employment tribunal found that he had wrongly been dismissed from UHB in 2017, initially for reasons that the then medical director David Rosser, who sacked him, either knew or should have known were false. Mr. Rosser also referred the eye surgeon to the General Medical Council for investigation. The tribunal judge was damning of this action.
That referral contained a number of material inaccuracies that suggest that either Dr. Rosser was deliberately misleading the GMC or, at best, that he had failed to give the matter anything like the level of care and attention required.
Despite such a critical assessment of his actions, Rosser was then promoted from medical director to trust chief executive.
We need to do a much more forensic analysis of the board papers at that time, the decision-making process. There may have been mitigation as to why that was never in dispute, but we just don't know that.
That's not something that, as the current chief executive of the organisation, I can comment back on from when that happened.
But you were chief operating officer at the time.
Yes.
What did you think when you read that employment tribunal?
I think that the employment tribunal was very clear in its findings. I think the trust responded at the time.
As we were preparing our original report in November, the Trust put out a statement saying that David Rosser was leaving UHB to take up a position at the Regional Health Board. However, through an answer to a Freedom of Information request, we found that David Rosser is actually still employed by the Trust.
Why did this organisation put out a press release on the 22nd of November saying that he was leaving the Trust and that it was a sad loss to the Trust, when he's never left the Trust? He's still employed by the Trust.
He's left his role as chief executive.
Sure, but he hasn't left the Trust, has he?
He's gone on secondment to work for the Integrated Care Board.
But you're still paying his salary, aren't you?
The NHS is responsible for...
But it's coming out of your budget at this hospital.
The NHS's budget, this hospital's budget. I'm really not at liberty to discuss any arrangements regarding Mr. Rosser's employment.
Right.
Sorry, just understand David Rosser's retired. The Trust has put out a statement.
As we were recording our interview with Mr. Brotherton, there was an announcement that David Rosser had decided to retire from the NHS. Other senior executives and non-executives, though, are still in place. Dr. Nicolusis, whose safety concerns were apparently ignored, says that's not good enough.
I must admit that with the current structure, I don't really think that the Trust will move forward a lot. I think what the Trust needs is the Trust needs new people to come in.
Are you certain, as the acting chief executive, the interim chief executive of this organisation, that nobody in the current leadership, management, have questions about their behaviour, how they behave, whether they were perhaps over-aggressive in their dealing with people who are raising concerns? Are you clear that none of them have questions to answer on that score?
If there are questions to answer, then we will answer them. As the chief executive, I will make sure that wherever in the organisation that it is perceived that we have the wrong kind of behaviours that are not in line with our trust values, then I will be dealing with that.
Professor Buick says that further personnel changes at the Trust may be necessary as new information emerges. Patients, though, know only too well that a diagnosis isn't the same as a cure.
That report produced by Sean Clare. Well, let's talk about what happens now and in the coming months with Preet Gill, MP for Edgbaston, who is also on a local committee monitoring the ongoing inquiries. Preet Gill, thank you for joining us again on this story on Newsnight. It is an interim report, but does it confirm your fears about what's been going on at the Trust?
Well, I think it's a disturbing picture of serious failings at University Hospital Birmingham. The allegations of over 50 whistleblowers from my constituency really confirm that toxic culture which is described. Professor Buick had the opportunity to meet 44 of those whistleblowers directly so that could be fed in to this part of the first review. And clearly, that culture contributed to the tragic death of Dr. Kumar. And, you know, today I chaired the cross-party reference group. We heard from Dr. Buick. There are lots of questions from this report, and this is the first report. Of course, it took place after 6 weeks. And one of the assurances we wanted from him is especially on the external reviews that he is suggesting into patient safety be carried out. When will they actually be taken about? And where does accountability actually sit? And how do we contribute to make sure that we are able to hold the trust, the ICB to account, to ensure that actually the confidence of the public is there in terms of making sure that, you know, people do feel safe. I'm assured by Professor Buick's evidence today to us stating that, you know, the safety issue isn't of concern. Of course, there are things that need to change. Now it's incumbent upon UHB to absolutely implement those recommendations. And what we've asked for is a clear implementation plan.
Let's pick up on that point you made a moment ago about the safety issue. I mean, it does seem, reading the report, that it walks a fine line. It says the trust is safe, but then it describes persistent failures, that need to be changed immediately, or else it will be or become unsafe. Are you convinced that they're not just trying to reassure people while simultaneously diagnosing these serious persistent problems?
Well, Professor Buick faced a number of challenges and questions in respect of what you've just highlighted, especially with the excess mortality deaths. Clearly, there was an issue of coding, but what Professor Buick assured us is that he has checked this out with other clinicians and he is going to monitor this, because what we were really asking for, well, what are the red flags that they need to be looking for? And surely we should be commissioning that report as opposed to just monitoring and waiting. And he assured us that this is something that he is absolutely looking at. But, you know, he's made sure that, you know, immediate patient safety isn't a concern. You know, he has tried to address many of the questions that we raised with him on this point, because, of course, culture does mean patient safety is compromised at times, and hence, you know, needing the timescales of when these additional external reviews are going to take place. This is really, really important. These are answers that we want, no doubt the public want to as well.
And presumably, as part of that cross-examination, you mentioned that they've got a 10% higher mortality rate than similar trusts. What was their response to that? I mean, did you find it convincing?
Well, I think what Professor Buick then sort of told us was actually, you know, quite a lot of trusts face this sort of issue. It's very difficult to say because, of course, he hasn't been able to look at lots of other departments. He's been concentrating some of that on the haematology elements. And so, given that he's going to be part of the culture-led review and he's asking subsequent questions in respect of these mortality rates, he's assured that he's able to follow those through as well.
Now, I don't know how much of David's latest report you heard, but he was talking to the interim CEO and at one point pointed out to him that he'd been the chief operating officer for years on the board. Is that right, do you think, or does there need to be a clean sweep?
I mean, look, this is the initial review and there are 3 parts to this review. Of course, the culture review will really get to the bottom of lots of the governance issues. Now, while some non-executive directors have been replaced, what the cross-party reference group are asking is for the new chair to actually attend that cross-party reference group and give a very clear idea of who has actually left, who is still there, and what is going to happen going forward. I have no doubt that many people will be reconsidering their positions as the next part of the review takes place. We've got to have the confidence of staff, because that is the only way we assure patient safety, and that is the only way that we can deliver services for people in the regions.
Preet Gill, thank you very much indeed. Well, bad news today for Jeremy Corbyn, as Labour's National Executive Committee voted by 22 to 12 to